So when we talk about exercise stress testing, we break it down into two different categories: non-nuclear stress test and then nuclear stress testing. So right now we're going to talk about non-nuclear stress testing. So in this category we have a plain exercise stress test, an exercise stress echocardiogram, and a dobutamine stress echocardiogram. So the first one we're going to talk about is exercise stress test, and the purpose for doing this is to screen for CAD and to assess exercise tolerance of the patient. So when we do a stress test, we require the patient to reach 85% of their predicted maximum heart rate while walking on the treadmill. So when you take 220 minus their age, you get the predicted maximum heart rate, and then you multiply by 85%, so 0.85, and then that number is your patient's target heart rate. So treadmill testing is the best method because you can adjust the speed and the grade of the treadmill. So like I said before you begin, you calculate your patient's target heart rate. So an example of this is 220 and your patient's 60 years old. So 220 minus 60 is 160 beats per minute. And then the patient should reach 85% of 160. So their target heart rate is 136 beats per minute. So we want them to be able to reach their target heart rate. So the procedure for a stress test, the patient must read and sign an informed consent. We take a history, we explain the procedure, the patient's given a gown. We use alcohol on a gauze to clean the skin, and we want to abrade the skin so the electrodes stick to the patient. We do a resting and standing 12-lead EKG and a resting and standing blood pressure. Once we are done with that, we take the electrodes, we put new electrodes and leads, and they're moved to modified lead placement. So what we do is we take the leg leads and we move them up to the waist area, and the arm leads, we move them into the shoulder area. And then the belt goes around the patient's waist, so that secures the leads when they're walking. And then we're going to follow the Bruce protocol, and that's already set up in the stress testing machine. And then we attempt to walk the patient for at least 6 minutes if they can tolerate it. The next one is exercise stress echo, and the purpose of this procedure is to evaluate the heart valves, evaluate wall motion and LV function, and evaluate myocardial perfusion based on the wall motion. So an echo is done prior to the patient walking on the treadmill, and then the patient will begin walking on the treadmill. When target heart rate is achieved, another echocardiogram will be performed. So again, the same procedure as the exercise treadmill test. So they read and sign an informed consent. We explain the procedure, we take a history, we give them a gown, we do a resting and standing blood pressure and a resting and standing EKG, and then we do the resting echocardiographic images. So a cardiac sonographer will be in the room along with the cardiographic technician. So we do a resting echo, and then the patient will walk on the treadmill following the same procedure, the Bruce protocol. And then once they reach their target heart rate, we hurry, get them back into the bed, and they do another echocardiogram. And you have to hurry with the patient because you don't want their heart rate to come down too quickly, then they won't get good enough images. And then the last procedure we're going to talk about in this area is a dobutamine stress echo. And this is the same as an exercise stress echo, but instead of walking them on the treadmill, we're going to give them a medication called dobutamine, which mimics exercise. So it's going to increase the heart rate. So this is for patients who are unable to walk on the treadmill. So dobutamine is an inotropic medication, so it increases the heart rate and blood pressure similar to the effects of exercise. It is used as a medication to mimic exercise. for patients who cannot walk and follow the Bruce protocol. So the side effects is they do get chest pain, shortness of breath, dizziness, shakiness, nausea, and these symptoms usually disappear within 10 minutes of stopping the dobutamine. And there will be a nurse there that will give this medication. You are not responsible for giving any medication. So this is for patients who cannot undergo routine stress tests, used to assess LV function, can also be used for cardiac clearance preoperatively, and then it can also be used for post-interventional cardiac assessment. So the patient prep for this is nothing by mouth except water 4 hours prior to the procedure, no smoking, no caffeine. The physician will adjust their insulin as needed, and then all beta blockers must be stopped 72 hours prior to the procedure. And this is because a beta blocker slows the heart rate, and if they do not stop taking the beta blocker, you will not be able to get their heart rate level up to their target heart rate. And the patient should also not wear lotions, powder, or oil on the chest area, so we can attach the electrodes properly. Now this patient prep is not a standard prep, so it can change from hospital to hospital, but just so you know the basics. So don't get too hung up on the 4 hours, because some places it's 12 hours, some places it's 8 hours prior to the procedure, so it just depends on the hospital. Again, the same procedure. They read and sign an informed consent. We explain the procedure. We do a resting EKG, resting blood pressure, and a standing EKG and standing blood pressure. The IV is inserted into the patient's arm, and once the IV is established, and again a nurse will do the IV insertion. Once that's established, then we do a resting echocardiographic image. Then dobutamine will be infused over 12 minutes, and then once they reach their target heart rate, then they will get more echo images. And then they discontinue the dobutamine, and then post-procedure echocardiographic images are obtained. Dobutamine will be discontinued if the patient exceeds their heart rate, their target heart rate, if there's any abnormal EKG findings, and if they do have significant symptoms such as shortness of breath or chest pain or increased blood pressure, we will stop it. If they do not reach their target heart rate with dobutamine alone, then we can administer atropine, which will also increase the heart rate. And they would do that in 0.5 milligram increments.